And I think that we will go ahead and get started. Thank you everybody so much for joining us this afternoon. We're very excited to share this application with you to apply to be a pilot site for our training and recruitment and retention project that we're working on so wonderfully with the Respite Association of Wisconsin in collaboration with the National Academy for State Health Policy. I'm going to pull up my slides right now so we can go ahead and get started. I hope you can all see those. Everybody seeing my slides?
Yes.
Great, thank you. Let me see here. Again, welcome. My name is Jill Kagan, and I am the director of the ARCH National Respite Network and Resource Center. And I am joined today by Lisa Schneider, who's the executive director of the Respite Association of Wisconsin. I think many of you know both of us quite well. So we hope this will proceed relatively informally. Once we make our presentation, then we will open it up for what we hope will be a lot of good questions. We have lots of information to share with you, so I'm not going to delay in moving this forward. Let's just start off by knowing exactly who is in the room with us. If you wouldn't mind typing into the chat your name and what state you're from, and maybe just a couple of words about why you are interested in perhaps participating in learning, or at least in learning more about our respite training curriculum and how we're modifying it and how we plan to field test it. You don't have to write a paragraph or do the application right now, just a couple of words. That will, when we look back on the chat, we'll have a good sense of who was with us. Then I'm going to proceed and do a really quick overview of the grant to provide some context for the project. Talk to you about our expert work group, which we have relied on heavily during this initiative, that we hope will, by relying on this expert work group, will really strengthen the effort. Then Lisa, I'll switch it over to Lisa, and she'll talk about their training program at Wisconsin, the core competencies that we are in the process of finalizing for this effort, and then dive right into the pilot project with information on how to apply and the details of the application process. This is us, all of us on the planning team: Jill Kagan, me from ARCH, Lisa Schneider and her team at Wisconsin, Val Madsen, who is the training guru at the association, Kim Whitmore, who many of you know from many projects ARCH has done with her, as well as from the international conference last week, will be helping with performance measurement and data collection for this project, as well as the final evaluation of the field test. And she's assisted by her colleague, Tyler Engel. And then at the National Academy for State Health Policy, we've been working with Wendy Fox-Grage, and many of you may know her from her advisory role with the Administration for Community Living's RAISE Family Caregiving Advisory Council. We're really fortunate to have her on the team. Now, a quick overview of the grant. ARCH partnered with the National Academy for State Health Policy to apply for a Lifespan Respite Special Projects Grant in collaboration with the National Academy for State Health Policy. And we were successful in that effort, and NASHB is the lead on the grant. We at ARCH here are leading part of a three-pronged effort on the respite provider training piece, but there are some additional goals within that effort that are really focused on helping foster other state and national efforts, especially those that are going to be emerging from the RAISE Family Caregiving Advisory Council's final recommendations. The overall objectives of this three-part grant, first is our piece, the Develop, Test, and Scale a Respite Workforce Recruitment, Training, and Retention Program. The second is NASHB will be the lead on this, and that's to develop and field test a state-based framework and roadmap for respite system planning and development. And then finally, the last part that NASHB and ARCH will be working on together to strengthen and test other approaches to help families identify and use other natural supports for respite. The outcomes, again, there's one outcome that ties to each of those objectives. The first for the part of the initiative that Lisa and that Respite Care Association and ARCH are collaborating on is to improve the evidence base for the respite care workforce training and recruitment to better meet the needs of respite families. The second objective is to strengthen the National Family Caregiving Strategy that we expect the RAISE Family Caregiving Advisory Council to be working on over the next year. And then finally, to support states in their efforts to improve and expand long-term services and supports, the respite care workforce, and the natural supports that I mentioned earlier, which have become so important, especially during the pandemic, and we expect post-pandemic, as well as formal respite services have been more difficult to access and may not look the same in the future. So we have a lot of work to do around looking at the informal respite system for respite support. Year one activities, I'm going to focus now just on this respite provider recruitment, training, and retention initiative. Our year one activities involve identifying what existing core competencies and evidence-based frameworks already exist for training direct support professionals. We use those to then work with our expert work group to come up with a set of core competencies that are specific to training respite providers, and that will be used to revise the Respite Care Association of Wisconsin's existing training curriculum to ensure that they align fully with these new nationally recognized, we hope, core competencies. And then finally, prepare to pilot the training and the recruitment marketing strategy in up to 6 states. Year two activities will actually begin the recruitment and marketing campaign sooner than we will the field test. We'll start working on that come October 1st under the leadership, again, of the Respite Care Association of Wisconsin. They've been doing a lot of work in this area already, but they will work with whomever is selected as a pilot site to develop this recruitment and marketing campaign. And then Kim will work with the pilot sites as well as the Respite Care Association to develop and refine any survey instruments. So we're collecting the best data during the pilot test and developing some evaluation strategies for the field test as well. The field test will then be started around January of the second year and complete in the middle of the third year. The rest of the project time will be used to analyze those results and complete the evaluation, and then develop what we hope will be a very useful toolkit for states with the important lessons that we learned from the pilot. Now, I just want to mention very quickly the expert work group because it's a really impressive group. We drew on national experts from PHI, from the Elder Care Workforce Alliance, from Anchor, which is a national association of agencies that work with people with disabilities, providing lots of direct support professional work. All of those groups have been, of course, intimately involved with a focus on workforce issues. So we were just ecstatic that they were willing to lend their expertise to this effort. We then had Lisa Maines from Family Voices to help lend a family caregiver perspective to this initiative. It wouldn't be complete without including that family caregiver perspective on the work. And then several of our state respite coalitions and some individual agencies that also provide and oversee a lot of work of direct support professionals. So it was a very comprehensive and expert group, and we're very grateful for the work that they did, and you can see their names on this list. And the expert work group was charged with reviewing all of the core competencies that already exist in evidence-based frameworks for training in a lot of the training initiatives that they're using nationally and in states, and to help us pull out those that are most relevant for respite providers specifically, and then to advise us on which of those core competencies we should rely on moving forward. So it was a really thorough process that worked very well. And we now have, Lisa's going to talk a little bit more about this, but we do have a set of core competencies now that are out for public comment. But Lisa will share that when she gets to that in that part of the program. So now I'm going to turn it over to Lisa to talk about her current training initiative, and then to move on to how this will impact what we're going to be doing in the pilot program.
Wonderful, thanks, Jill. All right, so hopefully you are all seeing my screen right now. So the Respite Care Certificate Program, do you guys see that?
Yes, I do.
Okay, great, wonderful. So our Respite Care Certificate Program is a creation of Val, one of our staff. She's actually been working on this for many years back and completely revamped it just about a year or so ago. It used to be called something else, but now it's called Respite Care Certificate Program, and it's really consisting of a number of modules that are fairly comprehensive, and it's free for people to take online. They can take it at their own pace, and there's pre and post tests, so we were able to measure the scores of learning. At least that happens as people are going through this, and if they complete the process with a 75% or greater, we're able to provide them with a certificate of completion. And we've learned that some agencies or employment companies are accepting that as a acceptance of the training that they've completed with us. So we're really happy that our certificate program is of value. Some of the core competencies for respite care professionals, again, Val did a really good job of having an overall, I think we had 10 modules. And currently some states that we're working with right now, it's Illinois and South Carolina, and I'm not sure who else is in the works. I do want to let you guys know just off the top that you're still available to apply for this. And should you be selected, right now we have a contract with you guys to pay for some of the access to our third-party training platform. If you're accepted, you will no longer have to pay for that. So with our core competencies, Tyler actually took what we had and we identified 21 different sets of competencies that were nationally published, and it ranged from a whole slew of different entities, and there was a big crosswalk that was created that basically took what we had and what they had and kind of matrixed it out to identify what trainings or what curriculums had what trainings in them, and were any of them missing from the respite care associations, and if so, were they considered to be part of the core curriculum that we really wanted. And so that process was done and identified, and that is what is out right now for giving people's feedback on that. And I believe that should be done in for public comment soon, I think. So you can, if you haven't commented on the public survey comment yet, here's the link to it that you can go on there and take a look at what the core competencies have been identified as and provide your feedback on what has been identified. So here were the key themes for each of the modules that we plan on having. Again, much of them have already been created. We've just added a couple more in there. We wanted to have the respite role and value, person and family-centered practices, cultural and linguistic competencies, communication and relationship building, health and wellness, safety and emergencies, planning respite activities, ethics and professionalism, professional development, and self-care. And this is self-care for the respite care worker that comes into your home, that we also want them, the worker, to understand how important it is for them to also practice self-care. So with that comes the pilot project. What are we going to do? It's really going to contain 3 main components, and one is for recruitment. We're going to develop selectively a targeted, comprehensive, effective recruitment campaign to reach individuals interested in providing care. We're going to be allowing training access with the states that are selected. It will be free to anybody who wants to take the training in the states that are selected. So it's so once we develop an enhanced online training curriculum that'll be provided at no cost that meets the core competencies identified by the National Work Group. And then we're also going to focus on retention and culture. So we want to, who we capture and train, we want to help keep them and also develop a very positive culture for people to aid in the retention. So we're going to develop tools to help create a workplace culture that provides long-term retention and turns respite providers into respite ambassadors for the services that are provided. The eligibility criteria for the pilot project are that applicants can include state respite or caregiver coalitions, governmental agencies, academic institutions, regional or statewide nonprofit organizations. Applicants with a statewide reach will be given priority. We're also looking for applicants that have experience already in providing respite and supports, collaborative partnerships to develop, enhance, and coordinate community-based respite care services. We're looking at capacity and applicants' ability to support involvement in the training pilot project. Oops. And then we're also looking at an applicant's readiness, so that the applicant needs to demonstrate the readiness to implement the training during the time frame of this project. Sorry, my cat got in my way here. So the applicant demonstration, we also want them to be able to demonstrate that they can sustain the project after this is all done. So we don't want it to just be a one and done. We want it to be something that once it's in place, that you can continue it on going forward. So as for the application itself, here are just a few highlights to the application. The application itself contains a lot of overview, I think probably 2 or 3 pages of overview in addition to the application itself, but here are some highlights that's included in that document. Again, we're looking for a local and statewide reach. Your responses to the following questions will help us better understand your agency, coalition, and its reach, as well as experience with respite provider training and recruitment. We want you to describe your agency or coalition's geographic reach. Is it regional, multi-county? Is it statewide? And we want you to describe your target audience and how you connect with them currently. We're also looking again in regards to capacity and experience. Your responses to the following questions will help us assess your agency or coalition and the capacity and experience that you have to support your involvement in this project. If your agency coalition currently conducts respite provider recruitment and training, please describe that. Describe how your agency or coalition supports collaborative partnerships to develop, enhance, and coordinate community-based respite care services. How does your agency coalition help connect or match respite care workers with families seeking respite? How does your agency coalition help connect respite care workers with training opportunities to expand the pool of trained respite care workers? To also describe policies, partnerships, and or respite funding entities that will support your involvement in this project. And to name existing funding or other relevant partnerships that will help ensure the sustainability after the pilot project's completed, and also to describe how you will do so. Another aspect is readiness. Your response to the following questions will help us assess your agency or coalition's readiness to implement the training and assist with the development of a marketing provider recruitment campaign. So does your agency or coalition have the ability to accept federal funds or involvement in this project? Do you have dedicated staff available right now to participate in this pilot project who can attend monthly meetings, conduct data collection efforts, and submit data reports? and your agency or coalition execute a contract within 30 days from notification of acceptance of the pilot project. This is one little thing that with some of the states that we've tried to work with, it takes a little bit longer. And because we're in such a tight time frame, we're really looking for those that can kind of get their way through this and hit the ground running within the 30 days from a contract standpoint. Please describe how you're familiar with your state's respite care worker training requirements across state agencies serving various ages and disability populations, and describe how you will quickly generate additional training modules in a relatively short period of time, if necessary, that meet your state-specific training requirements. So this is training that once we have the core curriculum training that we're going to provide, we realize that there's going to be states that have some specific training requirements. And so we'll have some templates that each of the pilot states will be able to create templates that will be incorporated into your access to the core curriculum. So each state will have their own access to the core curriculum along with their own state requirements that are over and above the core curriculum that we're providing. And lastly, we're looking for just a high-level budget. There's not a lot of money, but I still believe that there's a huge return on your investment with this, that it's really setting you up to go forward with something that's probably much needed in your state. So to just include a high-level budget up to $7,500 to utilize the grant funds to develop marketing tools, recruit providers for training, implement, and promote the field test and capture data. You'll not have to budget for monthly costs to access the Talent LMS platform. That's the training, the platform that hosts our training curriculum. These costs will be covered by the grant outside of the $7,500 that you can use to budget. And for some more background information on application questions, here are some links that you guys can go to, along with instructions on completing the application and links to the online application. And the timeline for this whole project, again, it's going to be pretty aggressive. So we're looking for the application to become open and available to you. I believe it's already available. Our target was 7/1. We're looking for any of you who are interested in applying, just a simple email to say, hey, Lisa, we're interested. I think we're going to apply, so we can kind of get a gauge for the level of interest that's out there. The application due date is 8/6/21, and we hope to announce the selected parties on 8/28. And we're hoping within between 8/28 and 9/15 that we will be able to execute the contracts with the pilot states that have been selected. And literally the next date, we're probably going to pull together a meeting and begin that pilot project. So the pilot project in more detail, which is included in the application overview, between 9/16 and 12/31, that's when we're really going to work on developing a marketing and recruitment campaign. So we're going to do that together. And so we're really going to implement the pilot project come January 1st, do it all the way through till 12/31. So we have a full 12-month of pilot information implemented and collected. So come January of 2023 through September of 2023, that's when Kim is really going to be working with all of us to do the data collection, evaluation, and then we're going to develop a replication toolkit for other states that might want to do something similarly. If you do have any questions, here is my information and Kim's information. Should you want to give us, just shoot us a question or whatever. If anybody does have any questions, I will probably send it to the rest of the group that is interested in applying so that we can kind of keep everybody on the same page information-wise. And if you want even more information, here is Jill's information. And I think we all know how to get a hold of Jill, so she's everywhere. I think that's it. So I guess I will stop sharing and we can open it up for some questions.
I know that was a lot of information we provided very quickly. So if there's anything, we wanted to make sure we got through it so we'd have plenty of time for questions. But if there's anything you want us to back up to and repeat, we're more than happy to do that. Does anyone have any questions on the background of the initiative or the intent or purpose of the project?
Also, is there anyone out there that you just want to type in your state that to indicate that, yeah, we're going to take a look at this and are interested in applying?
This is Utah in Arizona. I have a sort of fundamental question, and my apologies if I wasn't listening enough. Do you have a working definition of a respite care provider in contrast to a caregiver or direct care worker or direct support professional?
To be clear, and that's one thing that this is kind of entry-level training, so this will not achieve a CNA level training. So it's going to meet minimum requirements, at least to just perform work from respite. I don't know how other states are, but in Wisconsin, to provide respite for persons 18 and over, there's really no training requirements. You just need to pass a background check, and that's about it. When it comes to children, there's a definite set of training requirements that are required to provide respite for children, both from their various long-term care waiver programs. So, so in there, they've got a definition for providing supportive home care. You know, so I look at there's services and then there's workers. So it's really hard to determine. And I think this is where things get convoluted for all of us because there's just so many moving pieces. But the definition is just the minimum requirements in your state that's required in order to provide respite for the populations, the various populations. I don't know if you can jump on that, Phil, to.
I was just going to say that I think for our purposes, when Lisa says entry level, we're talking primarily about companionship type care. But if your state has additional requirements, or if you think you might want to meet additional requirements for serving, for example, children with medical needs, then I think there's the capacity to develop, you know, extra modules around those specific requirements or needs. But basically, the basic training that we are providing is a competency-based training for entry-level respite professionals. And the purpose of that is really, we're all working so hard at trying to figure out how do we engage more individuals and being interested in providing longer term supports. And one way is to begin engaging them as part-time respite workers. And we're hoping that this training is easy and free, and you'll have a recruitment campaign that's enticing, and we'll be able to bring people in as respite care workers with the ultimate goal of building the larger direct support workforce, because they'll become interested and engaged and perhaps wanting to move on to higher level training that, we will, I hope in our toolkit, develop some ways that we can keep these respite providers engaged and help them move on to higher level training as well.
Yes, definitely serve as a stepping stone. I see that Julian Nicholas has a question in regards to professional liability insurance lawsuit diversion. What we do is we just have a lot of disclaimers and for people to sign and acknowledge that this is just entry-level training. We're not doing anything medical, so there is no medical training. There is no med administration training in here. It's not necessarily how to do a proper lift. This is entry-level training, and for people to sign off on that individually, that they acknowledge that this is just entry-level training. We've had our attorney take a look at it. We've had no problems with it, but there's really nothing of risk in the training that we're providing. A lot of it is just knowledge-based. I don't know, Val, can you think of anything that's in there that might be of risk?
Yeah, we do go in, there is a med administration module. We do talk about some personal care, but a lot of the training, all of the modules really go back into talking about person-centered care and making sure that you're talking to the caregivers, the main provider, the family caregiver, to get what works for that person. Train me in the care that this person needs, because we can't cover everything in this training. And so a lot of the modules really go back to, you need to communicate well with that caregiver to make sure you're providing the high quality care that that person deserves.
And I think that that ties into other training that we offer. We have a whole online module for family caregivers to take on how to train their respite care worker, how to hire the respite care worker, so that we want to cover both ends. And so that because communication is so key in all of this, just like Val said, we're trying to promote person-centered respite care. So we also have training that's free and available to family caregivers to take better help them train the respite care worker that they engage with. I see that South Carolina, Oklahoma, New York, and
Delaware, I
Delaware.
believe. There was a question on here, can this serve as their letter of intent? By
Yes.
responding in the chat.
Yeah,
So we'll make sure we have a copy of this chat. So if you indicate your interest right here, you don't have to send a more formal letter of intent. We've got your name.
exactly. We're all about making this simple as possible. All right.
And just to clarify this, the training that we are modifying to become a nationally recognized competency-based training will all be online. There is no in-person training affiliated with this at this point.
So Cheryl asks, what number on workers participating in the training are you looking for? Hopefully the goal is to increase what you have now, to attract more than what you have now. That would be probably one of the key indicators that we'd be looking at is, did this pilot project increase your outreach, attraction, going fully through the training? I didn't know if some of you have registries that people can then be listed on. We have a registry, but some people literally use our training to go for employment purposes, because we do have employers that recognize our training. And we also have technical schools that are asking, especially in the gerontology side of things, for one technical school, our training is a requirement of that curriculum. So it's more than just getting a worker to be listed on your registry.
And of course, this training can also be used if you're interested in training volunteers.
Yep, definitely. Marilyn asks about how might this fit with consumer directed respite. Definitely, the consumer, I mean, this is person-centered. So again, from a communication standpoint with whomever, if they're the one that is hiring their respite care worker, that they can communicate and train on what their needs, wants, desires. We also push for respite to be meaningful and purposeful and intentional and person-centered. So it's not just a glorified sitting in the house and I'm making sure you're safe. We want it to be really more fulfilling than that.
And if you're interested, of course, in doing what the Respite Care Association of Wisconsin does, using these trained providers to then populate your respite registry or a respite database, that families who are engaged in consumer directed voucher programs, for example, would then have a pool of these certified providers that they could pull from if they didn't have someone in their own realm of natural supports to draw on.
Are there folks on this call right now that do already have an existing registry for respite care workers?
You can all feel free to unmute yourselves and ask a question too, because we're a relatively small group. So if you'd like to unmute and talk, please do.
Sarah from Arkansas. We are currently in the process of building a registry, an online registry for respite providers, and we have been asked about just individual respite workers and if we could incorporate them. So this would give us an opportunity to build that online registry out for not just the organizations that are providers, but also for individuals, and say that they have completed the training to give a little bit of certification, so to speak, to that individual.
Wonderful. Wonderful. Tina, you asked about the data that we're wanting to be collected. That's going to be part of what you get to help decide. So as a group, that we're going to work together on developing. We've got tools already, so it's not like we're coming to you with nothing. But we do have some tools already. We've got Kim, who is a researcher already that understands data, what data to collect, how to collect it, and then along the same thing with the outreach campaign that we will, once this group is identified, we will use that group to work through and identify those issues together, or those data points and marketing campaign outreach.
It really having the privilege and honor of working with Kim, an expert evaluator, to help us develop these tools. It'll be so exciting to be able to collect this data across states. And then really have, it may wind up to be comparing apples to oranges, but at least we'll have similar data tools that we're using across states. And I think that's one of the most exciting things about this project too.
Absolutely. Okay.
And ultimately, it's a very low cost training, free initially during the pilot, of course. And then the costs, if you just decide to stay on longer term with it, the costs are very minimal. So when you're thinking longer term about sustainability and how to keep this going, I think it's a really manageable initiative.
It really is. And again, Val is the guru on this. But because we already use this platform, we pay for a core cost already. We're not passing that on to anybody. So all that would happen is that your state might pay, if you have 100 learners on the system at one time, I think it's $50 a month. You would never get this if you were going to go out on your own. Do you have anything more to add on that, Val?
No, just what's great about this platform is you would also have the ability to add additional training modules. And that's something that I think is a really neat thing that we can do between states and be willing to share between states. If someone does something specific for caregivers, being willing to share between states, we can build a really robust free training program for people throughout the nation. And I think that's just a really neat ability to do within our platform and have it all in one spot. Why reinvent the wheel? We have this wonderful training. Let's share it. Let's get it out there. And really not trying to pass the cost on to you, just helping. We'll have to buy more spots so that we're just passing on the cost of those spots to you. So it is very affordable.
Absolutely. And I think they're able to generate their own state specific reports too. So they have access to all of that. So that's one thing that you guys can generate any reports at any time with your training program.
And because you have the opportunity to develop your own modules, while Val was saying we'll have uniform training across states, you can also make it completely adaptable to your state specific needs. If you need those additional modules.
Right. So for example, we're in partnership with South Carolina with Nicholas, and they have some trainings that are very specific for their state DHS department. So that's something they were able to develop online and offer just to their state respite providers. So again, a great way to host all the trainings in one spot. The platform is very user-friendly and really easy for people to figure out and use, and has a lot of kind of bells and whistles, and you can develop a lot of really neat things from it.
And if any of you want to go to our website at respitecarewi.org, feel free to take the training online and go scout it out. So you get a feel for what it is that we have, and get a feel for the platform. And then so you'll get an image of what it would look like. Right now it states Wisconsin specific. Yours would be, you could have your own logos, your own colors, your own everything. So nobody would be the wiser that it's really coming to a URL here in Wisconsin.
The training that you're seeing online now, of course, will be enhanced with these core competencies that we've developed with very specific to respite providers that we've developed with our national experts. So it will be changing to some degree, but as Lisa said, you can get a good idea of what the training is about, but recognizing that it will be modified somewhat to be enhanced and even better than it is now.
Yeah, well, and to go on that a little bit, out of the 10 modules, 3 are state specific. So what is respite? So half of that module is kind of basic, what is respite information, but then the other half is what is respite in your state? How does your state funding work? So then you would take the time to fill in that information. Abuse and neglect, again, half of it is general abuse and neglect, but then you fill in your information about your state laws and regulations. And then the third module that has more state specific is kind of the wrap up module. Like, okay, now that you've taken this training, this is what's available in your state to become a respite provider. So those are the 3 portions that you would have the ability to make some changes and additions to so that it is customized for your state. The rest of it is all very general information that really applies throughout the nation.
Cheryl, recruitment strategies. Yeah, that one is, that is something that we just did here in Wisconsin. We held a series of, I think it was 5 workshops, and actually Rachel is still here, so she might be able to chime in more on this, but we were focusing on our northwest part of Wisconsin, which is kind of adjacent to Minnesota. Minnesota has much higher minimum wage than Wisconsin does. And so we lose a lot of workers that might live close to Minnesota, but they want to work in Minnesota because Wisconsin pays a lot less. So we were concentrating on recruitment and retention up there. And so we hired this Blitz creative media group that all they do is focus on recruitment strategies for direct support professionals. So we have all that information that we have this section of the state go through is the 5 workshops. Some really great information in there in regards to how you use words and to make it the consumer, or the worker focused, little tips like, you first say you will be getting having a great opportunity to work in a field where, oh God, I can't even think of some of the phrasing, but it's like, we immediately say, what's your social security number? Where do you live? As opposed to hyping up the beauty and importance and function of respite care, and just give it a whole different approach with different words. And it's got a proven a history of working. And so we have those tools that we paid a good money for that we will get to share with you guys for free. And again, as a group, we will work together on developing strategies that we will all implement similarly so we can have as close to apples comparison as possible. Is there anything else, Rachel, that you want to add to that?
No, but yes, no, pause, yes. Just how everything, as you said, is worded, and they, sitting through the Blitz, the workshops, the little tweaks that they have suggested, it's incredible to see the data and what the increase in their new hires have been. So yeah, we're really excited to share that information.
And just to be clear that these guys themselves don't hire direct support professionals. They are experts and have been consultants to agencies that are looking to hire. We just package them up for a group, a region of our state to see that. And we've been able to access all those materials, and we will share that with all of you guys.
I'm going to put the just the link for Blitz's workshop in the chat. It doesn't do a deep dive with the information that we have, but if anyone just kind of wants to poke around and get a little backstory on who they are and what they do, it's in the chat right now.
And it is more than recruitment. It is the recruitment, retention, and developing culture. So it's all 3. So they've got a comprehensive portfolio of tools. And again, we will have access to all of that.
And the other really neat thing that they do, we did like a 4-hour training on, is reducing the amount of ghosting that happens with applicants that want to be direct support professionals or respite care providers, and how organizations can decrease those numbers and people show up.
Yeah, and stay. Are there any other questions?
There
Again,
was go ahead. I was
No,
just
you
gonna say
go
there
ahead.
was a question about what kinds of data do you expect will be collected?
yeah, that was the one that I think that we're going to work with Kim. And so once the pilot project folks are identified, that as a group, we're going to identify what data points that we want to collect, because we want to not only identify what we want to collect, we want to make sure that we are able to collect that information, and then how we're going to be able to report out and analyze that information. So it'll be a process that we'll work with together as a team.
It certainly won't be, we'll try to minimize any burden, of course, on all of you. You know, I think ultimately we want to know, is this training improving the knowledge of the folks that we're recruiting? Are we able to recruit additional people? So a lot of it will be process measures. Have we increased the pool of trained providers? We probably are not going to get into, you know, what impact has this had on family caregivers over time. That would be a little bit difficult to monitor for this pilot. But what are the immediate increases in respite provider availability and quality over this 1-year period?
And I think that's what's great about the training platform, is we're able to collect a lot of that information automatically. So we already collect information about providers and like what age group they're interested or they are serving. So we have a good idea of that. What areas of our state are they coming from? So we can see by region, you know, along with obviously pre and post test scores, so we can measure learning. So a lot of that will not be difficult things to collect, because it's already built into the training platform.
Right. I don't think it'll be anything terrifically burdensome at all,
No,
especially
I
with
think
Kim
you're
at the helm, because she's expert at developing those kind of data collection tools.
And again, that's the beauty of this Talent LMS, is it has a lot of built-in stuff. So, you know, the thing that you might want to look at is, does your history look like you're only getting, you know, 30 people a month going through your training, and then after this, you're getting 60 people going through, or 75 people going through. But we'll be able to measure the geographic region, who they're serving, their improvement in their knowledge and stuff like that. That'll all come from Talent LMS. We're really excited about this, though. I'm looking forward to some of your applications and working together, because I think we're all in for this altruistically, because I'm sure a number of us are family caregivers. I know I am, and respite is just a necessity for family caregivers. So we're just not in this, not only for ourselves, but we want to be in it for others. So this is really exciting. We're very excited to be part of this, especially working with Jill and having all these national partners and resources and knowledge available to us. So it's not just us punting the ball and hoping we score. We're going to go into this with a strategy, with a game plan.
And we're very indebted to the Respite Care Association for their willingness to share the platform and their expertise and their training experience. It's just going to be invaluable to the whole network.
Thanks.
Any other questions?
We kept it under an hour, so that's good.
You get a few minutes back to your day. And of course, Val and Lisa and I are available anytime if you think of a question after we disconnect today and you want to, maybe you look over the material and something's unclear, please feel free to send us an email and let us know what issues or concerns you have. And I hope all of you will consider applying. Again, we're only going to be able to, unfortunately, fund up to 6 states. And I think there are more of you here than are interested, but you'll at least be able to stay connected to Lisa and her team. Even if you're not selected as a pilot state, there still may be a way to participate.
And Dr. Cheryl, if you're not selected, definitely contact us, because we are already working with other states in regards to the training and materials and stuff like that. So that's a little bit separate, but we're all about sharing what we have. So again, the goal is to increase the pool of respite care workers out there, the quality in training them. So reach out to us if you're not selected, because we will definitely share with you. All right.
Okay.
Thanks everybody for your time today. Happy 4th.
Yeah, have a wonderful holiday, everybody. We'll see
Thanks
you
so
at the
much.
learning, for those of you that are grantees, we'll see you at the Learning Symposium.
Yes, yes.
Take
All right.
care.
Bye-bye.